Hello, my name is Romary Labajo and today's March 29, 2026 and I'm doing my Heent assessment video. And first, I'm going to ask consent from my patient. Hi Jordan, would it be okay to record the entirety of this video to upload in YouTube as unlisted for my professor to grade?
Yes.
Yeah, so I got my patient's consent. Now I'm gonna do the integrity check and I'm gonna show my camera. That's my camera right there. There's nothing in there. Gonna be showing the ceiling. It's the ceiling. There's nothing in there. And the 360 room scan. This is the 360 room scan and the floor. That's the floor. Oops. Okay. So now I'm going to start. No, first I'm gonna show my equipment. So this is what I have. And now I'm gonna start with my assessment. So first, I'm gonna check that the head is normal cephalic and it's not traumatic. I'm gonna check for the hair. I'm gonna inspect the hair. It's evenly distributed. There's no spots of any hair loss, no thinning. The hair is fine. The texture is fine. I can see no dandruff, no rashes, no lesions, no any abnormalities, no redness or anything. Now I'm going to palpate. I'm palpating for any lesions. I'm palpating for any depressions. I'm palpating for any hematomas or anything that's not normal, and I don't see any. Going to check for the cranial nerve 2, which is the optic nerve. I'm gonna ask you to cover your eyes with this card. Okay, so I'm gonna show him the Snellen chart. For the purpose of this video, I'm only gonna stand within the camera frame, but in real clinical setting, I will be standing 6 feet away from my patient using a pocket-sized Snellen chart. And if it's a wall chart, it's gonna be 20 feet away from the patient. So, Jordan, can you cover your right eye and read to me the last line?
LTFPH.
And what color is this?
Red.
Okay. Can you cover your other eye and read the last?
LTFPH.
What color is this?
Green.
Okay. Uncover your eye. And now read the last one.
LTFPH.
And what color is this?
Red.
Okay. I just want to confirm that my patient is not wearing any glasses or any contact lenses. You're not wearing any? Okay, so he's not wearing any. I'm giving him 20/20 uncorrected vision. And now I'm going to check for the eyes. General inspection. I can see that the eyebrows, it's symmetrical, it's evenly distributed. I don't see any ptosis, I don't see any blepharitis, I don't see any signs of infection, no redness, no lesions or anything. I am checking for exophthalmos, and to check for that, I'm going to check it on a tangential view, on the side, on the top, and on the other side, and there's no bulging. I don't know any exophthalmos. And I'm going to check for the conjunctiva. I'm gonna pull it, okay? And I can see it's transparent. The sclera, there's no discoloration, there's no redness, there's no jaundice. And I'm checking for the lacrimal duct. The lacrimal duct is showing me the median and the lateral lacrimal duct is, there's no obstruction, there's not much dryness, not too dry, not too watery. So, and it's normal, it's a normal finding. I can see that the iris and the cornea is round and the pupil is round and equal. And now I'm going to check for um, for the papillary reflex. Okay, Jordan, I'm going to shine some light on your eyes. I'm going to check for the consensual and direct reflex, okay? So I'm going to shine the light at the right eye first, and it's 5 to 3 mm reflex, direct reflex. And I'm going to shine light on the left eye, and it's constricting 5 to 3 mm. And now I'm going to check for the consensual on the right eye, shining the light on the left eye, and it's constricting 5 to 3 mm equally and bilateral on the other side, and the consensual on the left side is also equal 5 to 3 mm, and the pupils are equally reactive to light on consensual and direct checking. So my optic nerve 2 is intact. Now I'm also gonna check for the cranial nerve 3, which is the oculomotor. I'm going to check the cranial nerve 4, which is the trochlear, and I'm going to check for the cranial nerve 6, which is the abducens. And to check for the cranial nerve 4, I'm going to position you, just look at the tip of this pen light, and it's going to go to the midline downwards, and it is intact. Now, this is cranial nerve 3. Just follow the tip of the pen light. Cranial nerve 6. So my cranial nerve 3, 4, and 6 are all intact. Also to check for, I was also checking for nystagmus, and I don't see any abnormal movements of the eyes. I don't know any nystagmus. Also gonna check for convergence, which is the patient is gonna look at the tip of this pen light, and it's gonna go closer to the nose. And I can see an inward movement of the eye, which is a normal finding. So I have done the convergence check. Now I'm gonna check for the accommodation. I'm going to check for a near and far. So near object, can you look at the tip? And I can see that my patient pupils is constricting. And if you can look at the object behind me, I can see that the pupils is dilated. So I have checked the accommodation. Now I'm going to check for confrontation. So that's gonna be the peripheral vision of my patient at 180 degrees. Now I'm going to ask you to close one eye, the right eye first. So as he closes his right eye, I'm going to close my left eye. Okay, so you can cover it if you want. So I'm gonna cover my left eye too. Can you see this? Tell me when you see it.
There.
Okay.
There.
Okay.
There.
Okay. Can you close the other eye and open the other eye? So as he closes the other eye, I'm gonna close my opposite eye.
There. There. Right there.
So I can see that the peripheral vision of my patient is intact. Now I have already done all three of them, and now I'm gonna need to do the fundoscopic exam. So using this tool, I'm gonna be shining light on your eye. I'm gonna be checking your eyes again, okay? So what I'm gonna do, I'm gonna find the red reflex, and at 15-degree angle, I'm gonna be using my right hand and right eye to check for my patient's right eye. And using the opposite hand, I'm gonna be putting it on my patient's forehead for safety. So I'm gonna check for the red light, and I can see the red light, and I'm going in, and I can see the cornea and the lens is free of opacities. I am also checking for the arteries is lighter and smaller, and the veins is darker and bigger, and the optic disc to cup ratio is 1:3. And now I'm going to check on the other side. I don't know how to do it without covering the patient. Okay.
Right.
Yeah.
So,
Okay, that's good. So now I'm going to check the left side. I'm going to use my left hand and my left eye to check for the patient's left eye, and use my right hand to hold the head. Now the same scenario. I'm going to be checking for the red eye, red reflex, and the cornea and the lens is free from opacities. I am seeing that the optic disc is 1:3 ratio, and I'm seeing the veins is darker and larger, and the arteries is smaller and lighter. So now I have done my fundoscopic exam. So I have checked all my cranial nerves, 3, 4, 6, and 2. I am now going to check for the nose. So I'm general inspection of the nose. I don't see any redness. I don't see any swelling, no signs of inflammation, no erythema, no edema, no any abnormalities, no discharges that I'm seeing. So upon palpation, I'm gonna need to palpate the patient's nose. Upon palpation, I don't feel any polyps, I don't feel any bumps, I don't feel any lesions. There's no lesions, there's no abnormalities that I'm feeling. Now gonna palpate for the sinus. I'm gonna palpate for the frontal sinus. Is there any pain?
no pain.
No, okay. I'm gonna palpate for the maxillary sinus. Is there any pain?
No pain.
No pain? Okay. So, and that is a normal finding. After that, I am gonna be checking my patient's nose. Okay, I am gonna be checking your nose, alright? If you hyperextend your neck for me. And upon examination, I don't see any polyps, I don't see any discharges, no lesions, no bleeding. I don't see any abnormalities in the patient's both nares and subordinate. There's no redness. I don't see any swelling, no obstructions or anything abnormal on both nares. Now I'm gonna ask my patient to. I'm gonna do my hand hygiene. I'm now gonna ask my patient to close one of your nostrils and take a deep breath. Breathe out. Okay. Can you do it like on another nostril? Breathe out. Are you breathing okay, both equally?
Yes.
Same? Okay. So I have tested for the nasal patency of my patient. I am now gonna ask him to close his eyes and smell this one with the other nostril covered. So you will cover your other nostril. What smell is this?
Fragrance.
Okay, so it is fragrance, very good. Now I'm gonna ask you to close the other nostril and smell this.
Mint.
Okay, and that is correct. So I have now assessed my patient's olfactory cranial number 1 is intact. Cranial nerve number 1 is intact. Now I'm going to proceed to check for the ears. I can see that my patient's ears is symmetrical. There's no lesion, there's no swelling, no redness. I don't see any discharges upon inspection of the external ear. Now I am going to palpate your ear, okay? I am gonna palpate the pinna. I don't feel any lumps, any bumps, any lesions. I'm palpating the lobe. I don't feel any lumps, any lesions, or any abnormalities. I'm palpating the tragus. And is there any pain? Tell me when there's pain. I'm palpating the mastoid. Is there any pain? No. Okay. I am now palpating the pinna. Is there any pain?
No pain.
And the lobe, no pain. Let me know if there's any pain, okay? And the tragus, no pain. And the mastoid, no pain. Okay. So now I am going to check for the special test. First is I'm going to ask you to cover your one ear, your tragus. Yeah, do this one, and then spin. Okay, and then I'm gonna whisper and you repeat what I whispered.
A, B, C.
Correct? And that is correct. So the other ear, same thing, spin. 1, 2, 3.
1, 2, 3.
And that is correct. So I have done the whisper test and my patient can hear on both ears equally. Now I'm gonna do is the Weber test. So I'm gonna activate this and put it on your forehead, okay? And let me know if you can hear equally.
Stop.
And can you hear equally?
Yes.
Okay. Now what I'm gonna do is the Ryan test or Renee test. I am gonna put it on your mastoid at the back, and you're gonna let me know if when it stops, okay? Oh.
Stop.
Can you still hear it?
Yes.
Yeah? Okay. Good. So now I'm gonna assess on the other ear.
Stop.
Can you still hear it?
No.
Yeah?
Oh, yes.
Okay. So he can still hear it, and therefore both ears, I can say that the air conduction is greater than the bone conduction on both right and left ear. So after checking that one, I'm gonna be doing, I'm gonna be checking the ears. Okay, I'm gonna be shining some light on your ears and I'm gonna be checking it. So this time I'm gonna be using the safety technique. While holding the otoscope, I'm gonna be putting 2 fingers, my 4th and my 5th fingers outwards while I check my patient's ear, and this hand will be holding the forehead. I'm gonna go in, and I'm seeing no discharges. I don't see any effusion. I don't see any obstructions. I don't see any cerumen. I don't see any lesions, no redness, no signs of inflammations, no swelling. Now I'm gonna check to the tympanic membrane. And now I am checking the tympanic membrane, and I can see it's intact. It's pearly gray in color, and there's no signs of bleeding. There's no any abnormalities that I'm seeing here. And I can see that the cone of light is at 5 o'clock for the right ear. Now I am going to check the ear from the left, and same thing, I'm going to hold this on my left hand, and my right hand will be holding my patient's forehead. And I'm gonna be using the technique of 2 fingers out. So I'm gonna go in, and as I go in, I'm checking that the patient's ears has no cerumen. I don't see any effusion or any discharges, any redness, any swelling, any lesions. I don't see any. And now I'm gonna go in, and I'm seeing the tympanic membrane is pearly gray in color. It's the same as the other ear, and I don't see any redness. I don't see any bleeding. So it's not ruptured, it's intact, and I don't see any obstruction. And the cone of light I'm seeing at, so this left ear, the cone of light I'm seeing at 7 o'clock. And now I'm done. I'm gonna do the hand hygiene again. So I'm done with the ears. Now I am going to check for the mouth. So I'm checking the lips. The lips is symmetrical. There's no lesion, no redness, no swelling. I don't see any abnormalities, no ulcerations that I'm seeing here. And are you able to open your mouth for me? Okay. So now I am checking the buccal mucosa, and I don't see any white patches. I don't see any redness, any lesions, any ulcerations, any swelling, no signs of infection or inflammation. And I am seeing the patient's teeth. There's no dental caries. There's no I don't see any abnormalities in the patient's teeth. There's no broken tooth. There's no missing teeth or anything. Upon checking the gingiva, I am going to check your gingiva. The gingiva is pink and moist, and I don't see any bleeding. I don't see any patches, white patches. I don't see any ulcerations in the gingiva, and I don't see any abnormalities, redness or swelling, or any chances that the patient has prone for bleeding. Also seeing that the salivary glands is, you can close your mouth now. I'm also seeing that the salivary glands are intact. I don't see any abnormalities of the parotid duct and the submandibular duct. And I am also checking for the tongue. The tongue is rough. Can you move your tongue? Can you bring your tongue out? Okay, can you bring your tongue from right to left cheek? Okay, there's a good movement of the tongue. And now you can push the tongue to your right cheek and then the left cheek. And I can see a good strength of the tongue. And that I'm checking for the cranial nerve 12 for hypoglossal. I am now going to check my patient's cranial nerve 9 and cranial nerve 10, which is the vagal and the glossopharyngeal. Glossopharyngeal, cranial nerve 9, and cranial nerve 10, which is the vagal. I am going to ask you to open your mouth and say ah. So to check my patient's uvula is raised, and it's the tonsils. It's no redness. There's no swelling or anything. Also checking the patient that he's able to swallow. Can you swallow? Okay, he swallowed well, and it's in midline, and there's no difficulty swallowing, and therefore cranial nerve 9 and 10 are intact. and to check for cranial nerve 9 and 10, but we're not gonna be doing that. Is one way to check it is to gag the patient, gag reflex, but we're not gonna do that. Next is I'm going to check for my patient's throat. I'm gonna be asking you to move your neck. I'm gonna be asking you to move your head from flexion first, good, and then hyperextension, and then that's good. No pain or anything? Any pain in your neck? No? Can you move from right to left? Side to side? Good job. Now I'm gonna ask you to move it against the resistance, okay? Move. Okay, good job. And on the other side, move. Good job. Okay, so my patient can move from against my resistance, and that's checking the cranial nerve 11, the spinal accessory muscle, a spinal accessory nerve. So I'm gonna be asking you again to check the cranial nerve 11, to touch your ear to your shoulder and shrug it again. Okay, is there any pain? You can shrug it. Okay, I'm gonna ask you to rotate it, and therefore the cranial nerve 11 is intact. So now I'm going to check the throat. I'm going to ask you to swallow. Can you swallow? Okay, good. I can see that the throat is midline. I am going to palpate, okay? I don't see any lesions, any goiter. Upon checking in a tangential view, I don't see any goiter. I don't see any swelling or any redness lesions or any abnormalities. Now I'm going to palpate it, and I'm going to check for the thyroid. Okay, and now I'm gonna go down to the cricothyroid, and it's midline. Can you swallow? Swallow for me? Okay, it's midline, and there's no difficulty swallowing, right? There's no pain, the patient is non-tender, it's midline, and I don't see any abnormalities. So now I'm going to check for the neck, for the lymph nodes, okay? I am going to palpate the lymph nodes. Occipital lymph nodes, I'm palpating the occipital lymph nodes. I'm going to palpate the periocular lymph nodes, auricular lymph nodes, the posterior auricular lymph nodes, the posterior cervical lymph nodes, and the anterior cervical lymph nodes. I am also palpating for the submandibular lymph nodes, and it should be rubbery, like all of it should be rubbery and of pea size. It shouldn't be enlarged and tender. Is there any pain on the lymph nodes that I palpated? I'm also palpating on the submental lymph nodes. I am also palpating on the supraclavicular lymph nodes. Is there any pain? Okay, so it's not enlarged. I don't see any abnormalities. So now I think that concludes my assessment, but I would like to make sure that I did all of my assessments, and I'm on 28 minutes right now. Yeah, so I should be taking this off and doing my hand hygiene from beginning to end, before and after touching the patient. I have all of my cranial nerves intact on assessment. From cranial nerve 1, I did the olfactory, cranial nerve 2, the optic, I did all the cranial nerve 3, 4, all of it. I'm not missing anything. So that concludes my assessment. Thank you for your time, Jordan.